Wanted to share with you a little bit about Southwire, just in case you may not be familiar with us. We're in Carrollton, Georgia, which my joke earlier was head toward Alabama, then turn left, and just go for a while. Just when you think you're lost, you're almost there. But we're a private company. We're a $5 billion company. The shareholders of our company are the children and grandchildren of Gen 1, Gen 2, as we like to call them, of our founder. And one of the privileges that we have is being able to talk to them and communicate and hear back from them. And many of the wonderful things, and I've worked for public companies and I work for private companies, is do not be deceived by the fact that we're private. That does not mean that we're not watching what we're doing and being very, very efficient in the way we do it and the way we grow. As I mentioned, we're a $5 billion company. Our goal is to double that in the next 10 years. So, unfortunately, the way it looks, that won't happen from what's going on here in Georgia. But next. Let me tell you just a little bit about Southwire. We're actually the largest wire and cable manufacturer in the U.S. When you look at how we compete internationally, I think we're tied for third, although I think one of them's up for sale, and we're the only one that's here in the U.S. So that's very important to us, as well as our shareholders. We have about 7,500 employees, the majority of them here in the U.S. We do have some facilities in other locations, but for the most part, we're U.S. driven. We have 32 wire and cable plants throughout the U.S., 10 customer service centers, which is where we cut and draw wire at different lengths and distribution more than anything else. Right now, we've gone from 11 groups to 2 groups to 5 groups. We have 2 groups now. So it's all about one Southwire getting back to our roots. It relates to the construction system, and then it relates to the power systems. And as mentioned earlier, we are global. If you were to guess how much we're going to spend next year on healthcare, and that's just here in the U.S., I would dare to ask you to guess, but you will gasp when I tell you what that is. $91 million. That is what we're going to spend. That is a budget. That is responsibility that within HR that we have to manage. So it's something that we take very seriously. Our employees, for the most part, are hourly employees, rank and file, as we like to call them. They're standing on their feet 12 hours a day in conditions that are not heated or air conditioned, and they're working 24/7. Our average tenure, I have someone that works with me who's been there for 43 years. I've been there for about coming up on 11, and I'm still a newbie by all stretch of one's imagination. But 91 million, when you start looking at how that's going to be spent, 60% of that is directly paid by Southwire through the claims and other expenses that we have. 20% of that employees will pay in premiums. As you well know, premiums are what you have to pay to be at the table in order to have the coverage. And then you've got another 20% laid on top of that that relates to those that use the services, what they're paying in their what we call out-of-pocket cost. So, and those are obviously, you don't always know what you're going to have. Not the same people, the same amount every year, but that's kind of the split of how it works. So you can see the economic impact of this, not only on Southwire, but our employees. And at Southwire, the reflection of who we are is our employees. And as I mentioned earlier, I'm very blessed that our shareholders view our employees as being very, very, very important. They are the community. They are the people that make us who we are. We currently, probably just a couple of things that you may want to know. In Carrollton, we have an on-site medical center and pharmacy that we've had for over 20 years. It is a primary medical clinic, not workers' comp or occupational health. It is strictly primary medical care. I have 5 mid-level or MD providers there. Our clinic is certified as a primary medical home, although that companies are we're moving away from that kind of just thought. But we also have a physical therapist on site, digital x-rays, mammographies, and a lab. Next door to that, or built into the same building, is our pharmacy. And probably the 10 years I've been there, we've had 5 different companies own our medical center or pharmacy. But if you ask those people who they work for, they'll tell you Southwire. We may not write their check, but they are committed to understanding and helping us as we navigate through a system. We've really done a lot of changes over time. There was a time where pharmacy was the goose that laid the golden egg, so to speak. In relationship, if you could find a way to buy pharmacy drugs directly and get any kind of discount, you really had to be stupid not to be able to make that work. Well, those times are far, far behind us. And probably looking at a system of care, I cannot imagine, because I can't duplicate, I don't have enough employees everywhere to duplicate an on-site medical center and pharmacy, but having that gives us an edge, and it helps us better understand, but it by no means is something that makes everything okay. It just means it's a different system of care. And probably the biggest change that we've made over the last 4, 5, or 6 years has been around pharmacy. And it's been something that, while isn't the big dog of all that 91 million, it is the largest and fastest growing component of it. And it doesn't take many people to move that needle when you think about specialty medications. So we probably 4 or 5 years ago, we started contracting with Walmart. We did direct-to-employer pricing. Caterpillar had just done it. So we kind of had some resources there, chatted with them. So for people in Carrollton, use our on-site pharmacy. Everywhere else, we ask you to use Walmart. And oh, by the way, if you don't, it costs you a little more. And often I tell employees, if you go use another pharmacy, I can't make it cheaper because they don't give me the deal that Walmart or my on-site gives me. I can't give you what I don't have. So it has been quite effective, but it's been effective in different ways over time. Right now, we've moved all of our specialty medications as far as distribution through our on-site medical center. And the reason we did that is we started looking at coupons, for instance. You know, some of these drugs are $20,000, $30,000 a month, or dose. So we started seeing manufacturers' coupons out there that were $6,000, $7,000, $10,000 for one bill. But the employees were the only one that were able to access that. We don't have a big copay on specialty. We don't want to make it so you can't get your medication and what's going on. But we started working with our on-site to use those coupons so that we all benefit from it. Our employees, pretty much it covers their copay, but we're able to get that particular component, those dollars back. Now, one of the things I'll tell you is that within the first 6 months, we had saved $200,000. And that is saved, and I use the word saved because that's a very deceitful word. It's bending trend most of the time, making it not as bad, but we literally took $200,000 out of our cost. Employees didn't get it, Southwire didn't get it, we got it back from manufacturers, and that felt good. So there's not many of those situations that occur. It's a very complex system, pharmacy, but I will tell you that system of care is one of the most important things, intuitively knowing how to use it and having it there, but we have to measure and we need data. Those are things that are quite lacking in our system.